Texas Health Center at Houston, as well as an MS in bioinformatics. So without a further ado, we'll get right into the talk from Taha.
Hello, everyone. My name is Taha. I'm Director of Machine Learning and Chief Medical Officer at Amazon Web Services. Really glad to be here with you today, and sorry we couldn't be in person due to the COVID pandemic. Today, I'll be discussing the role of artificial intelligence in transforming healthcare, a topic that I'm really excited about. For a number of reasons. First of all, artificial intelligence is not a psycho to be able to find intelligence application of trying to identify sepsis within a hospital. And if you look in the last 3 years, it's really amazing to see over 100,000 PubMed publications having the topic of artificial intelligence. Almost half of those talk about deep learning and various ways about how machine learning and its applications surfacing in artificial intelligence applications throughout administrative, throughout operational, as well as clinical differentiating diagnosis and treatments and drug discovery. So, and you probably have seen these technologies described in a number of various ways across industry, whether it's financial, in environment, and manufacturing. And if anything, Amazon is the greatest example about this. If you receive the shipment to your home, most likely you have experienced artificial intelligence. And then with the adoption of cloud computing, cloud was invented by Amazon. You can realize that how the computation power needed for distributing these algorithms at scale and accuracy is something that really can bring this to many applications within the palm of our hands or within our realm in various applications that required human intelligence. Almost always this is related to some kind of complex decision making where human judgment would be required. Most use cases for AI are looking for probabilistic outcome. For example, can you make a prediction or a decision with high degree of certainty, similar to human judgment? Most also AI systems today created using machine learning, which uses large amount of high quality data to create and validate decision logic known as model. And then the AI application then feeds input data into that model, and then that model outputs human-like decisions. So machine learning is sort of the underlying technology or engine that is powering this intelligent system. And while deep learning is one type of machine learning, of course, there are many other techniques there, but it's the highest quality sort of approach that known as deep neural network, similar how the brain functions and how the networks are interconnected. This lets AI systems really address more complex use cases that was previously than that was previously possible. One of the greatest things about artificial intelligence is various applications where we believe the dust has settled on things such as natural language understanding and processing, such as pattern recognition of various applications, as I'll talk to you about, and as well as prediction and forecasting based on prior knowledge or a priori experiences that we have. The reach of machine learning is growing from being aspirational technology to really mainstream applications, incredibly fast pace, and many with outcomes that you can actually measure and benchmark against. For a long time, technology was limited to a few major tech companies or academic institutions, and where you needed a ton of expertise and knowledge to be able to kind of use these tools or develop in these tools. But things began to change with, as I mentioned, cloud computing entered the mainstream, where and vast amount of compute and data required have become more readily available and affordable. Quite literally, machine learning is now making impact across finance, retail, fashion, real estate, and many applications in healthcare as we see in our today's, especially with our customers in Amazon Web Services that I'll touch on throughout the talk today. It's moving also from being proprietary to being core part of every business and industry, democratize, where we can see many applications at the edge and global applications, which is something that today we dearly need in healthcare. If anything, to close the gaps in healthcare. If you look at the world population today, almost 50% of the world population does not have access to any kind of care, not just high quality care. And this is really where machine learning can help bridge a lot of these gaps, whether through telemedicine, whether through accurate predictions and forecasting, and as well as provide many tools to connect the dots with many of these patients, where you can aid doctors and physicians to really scale to cover more population, especially with repetitive tasks such as screening and routine medical tasks. Let me start what we hear quite a bit from our customers as today with a number of challenges specific to healthcare, which is sort of the topic of today. The great thing, as I mentioned, about artificial intelligence is the more accurate algorithms such as deep learning, the cloud computing that can really help us scale and provide the necessary infrastructure to operate these algorithms. But there's also different kind of shifts in healthcare that is going to aid more and more of data sharing. There's more outcome based, so the value-based care that's required to make decisions. So the healthcare is moving from pay for procedures to pay for performance and outcome. So that way, where you can, as you treat patients, you also pay attention to prevention, as well as what is the right sort of approach as a team of healthcare providers be able to take care of an individual end to end. So that requires many data points about the individual longitudinally presented in a way that you can start finding sometimes needles in a haystack, and oftentimes is connecting the dots in a patient journey towards really making the right assumptions about this individual and what is the right treatment path for them, and then be able then to measure how the different interventions or treatments or preventions are really helping this individual, which ultimately what we're trying to kind of get to the known as the precision medicine. How can I treat an individual for everything about them, the environment that they sit in, but also everything we know about them from not just the medical history, but also from the social, economic data, as well as genetic information, family history, and everything, and how we can really kind of, the constellation of all these can be put together. So value-based care, as it stands, which is requires quite a bit of data-driven decision-making, but we don't have the necessary resources to implement, is what we hear often from customers. When I talk to colleagues of mine, physicians, I mean, burnout is Owen, it's a big part of healthcare in the front lines is a lot of manual processes they have to go to. Even with digital systems like electronic medical records, they need to input those data. The finding and retrieval information is just as repetitive task, and oftentimes is a daunting task. I mean, imagine that you have a patient that you're taking care of, have been through so many different procedures throughout their journey across many institutions. I mean, literally sifting through Harry Potter worth of documentation that you need to kind of extract the right level of meaningful information from that to be able to kind of care for them and help them. If you look at the IT systems that power most of the healthcare infrastructure today, these are traditionally lack agility in how they're built and how they scale. and customers want to keep a pace with the technology, then that can really improve patient outcome in the end. Also, topic on everyone's mind in healthcare is insufficient security and compliance and availability that can really hamper their ability to compete and open the door to sophisticated and hard to identify attacks. And lastly, our customers are expecting different kind of experience, and the same thing with patients. And similar to consumer experience, they would like to, patients would love to engage with their health more, but similarly, healthcare systems, they want to change that experience to the level that they're engaging more with their patient by knowing more about their journey, and as well as how they can help. So how machine learning can help? Well, there are a variety of ways where we're seeing machine learning is being incorporated in healthcare. From driving trends and findings and insights, for example, from what constitute the large amount of healthcare data today, the unstructured data. That's voice, videos, images, X-rays, and MRIs, as well as large amount of narratives that's being documented in various ways within these healthcare systems, all the way to focus on differentiated value add by automating expensive routine and manual processes, as well as building innovative new products. This is really where we believe machine learning can help solve some of these challenges. If we're to pick on a few of these areas, for example, care quality improvement, this is one of the important ways to improve patient care is by understanding and analyzing information trapped within their record, and then identifying the relationship between these as the disease progress, or as the patient sort of treatment pathway changes over time. And these come oftentimes, as I mentioned, in narrative forms. These are like unstructured medical text, like hospital admission notes, patient medical history, as well as many of different formats and different stored in different systems, like someone's electronic medical record versus where you have your EKG for the heart scan, or the EEG for the brain scan, and video visits and transcriptions of dictations of doctors' notes and so on. So by pairing individual health with predictive analytics, machine learning can really improve patient lives and personalize the care experience. Where we're seeing a lot of applications here is reduction of readmission to hospitals after a patient has gone through their procedure or their visits, clinical utilization, and how we can help people live better lives possible. If I give concrete examples, last year we worked with Harvard Bethesda Deaconess Medical Center on using deep learning models to optimize schedule for 41 operating room. And they were able to align those schedules to improve patient flow, and in a patient setting where they use a product that I'll touch on today that understand the context in medical narratives called Amazon Comprehend Medical. They were able to extract key medical terms and insights that they used to model in their machine learning models to identify history and physical key findings for each patient, and in the end, operationally end up saving 30% of their operation efficiency, which is the next topic on here, where machine learning adoption in healthcare industry. We're seeing the application of that for lots of documents and data. You look at prescription claims, medical forms, images. Maintaining up-to-date medical record has become really a complicated process. But machine learning is simplifying many of these using document classification, natural language understanding, such as text extraction, speech-to-text technologies, and medical comprehension capabilities, so you can understand the full context about an individual, about their history. So this is helping modernize also, like the care infrastructure that is reducing operation overhead. If you look at Cambia Health in the Northwest, building solutions that automatically extract information from medication, medical conditions and treatments or procedures, and then document them in a single user-friendly platform that cuts across many of the underpinning systems that where the data is being collected, and then making sense of it on one longitudinal view. UK, United Kingdom's NHS Business Service Authority is also improving customer experience and by reducing the wait time using natural language understanding in their call centers. Oftentimes in healthcare, there's a ton of data that needs to be used for research. And there's a lot of back and forth exchange of this information across healthcare systems that increase the risk of compromising protected health information being shared. So this is another area where a machine can do a really amazing job in detecting these PHI data and then be able to, on top of that, build the right model to mask or redact this information before you share the rest of the information about any patient, for whether it's for analytics or for patient care or outcome or research. And lastly, one of the major areas we're seeing a lot of our customers really adopting machine learning is in a patient population health analytics. So, for example, predicting health outcome for a certain cohort of population. This is the case with Cerner. Healthy Intent, for example, that used working with us on the technologies we have in machine learning on predicting heart failure, risk of heart failure for the patient up to about 15 months in advance, and which gives you a ton of time to be able to intervene and find the right intervention that is needed to get at that particular patient at that particular point of time. Revenue cycle management, for example, automating claims processing, insurance claims or billing claims, which can be very manual processed today and can take a very long time. And oftentimes you end up missing a lot of procedures and treatments that you should have built for, where also machine learning can help with that. And most importantly, also increasing customer engagement, and in this case, the patient as well as the caregivers and the healthcare providers, where chatbots or ambient sort of experiences are really improving the customer and consumer engagement. All the way from from call center solutions or digital front doors, for example, triaging patients to the right treatments, which is what we see a lot today in COVID. This can be ahead of a telemedicine visit, or could be ahead of actual physical visit. So be able to kind of triage the need and then be able to take that to the next level, all the way to actually having the actual visit, especially like virtual visits. A big area, as I mentioned earlier, is natural language processing and natural language understanding, and healthcare is really ripe for this kind of adopting machine learning to solve this problem. Today, the vast majority of healthcare data is unstructured in nature. So if you want to build machine learning that can really try to kind of get at many of these use cases, as I mentioned, you need to have a lot of data in higher quality and structured in a way that you can really tap into. But when it's trapped into free text data, physician order data, and nurse notes, dictation notes, this is where natural language processing can really help. And some of our customers, as they face these challenges of dealing with unstructured data, we have been working on many solutions to really help extract and structure this data in a way that adheres to the medical terminology, so that way you'll be able to kind of adopt analytics, and machine learning algorithms on top. A lot of healthcare organizations have a huge amount in this form of unstructured documents. And two things that are really important here. First is extract the right key information from these various forms. of how the data is captured, whether it's an image, an audio transcription, or form, but also understand the context behind it. For example, if a patient had something in their history, but that's something about the patient history. If the patient stopped taking a medication and start taking another medication, that context is very important. And oftentimes, local developed systems, they're really great at extracting keywords, but what they miss is that context about how these entities or keywords are related to one another. Like, for example, this adverse drug event is related to this drug that was started on this date, and then in the larger context, it might be in aggregation, might be seeing a pattern of this behavior across your subset of population that might be at risk of one condition or another condition down the road. So with that, having the right foundation to not only extract the data, but also understand how the data interlinked with one another, and the knowledge graph behind that, it becomes quite a bit of differentiating heavy lifting for many of these customers. And by using natural language understanding or natural language processing with the underpinning of machine learning, you can start making sense of a lot of data that is clinically relevant from this information. So let's double click on this a little bit about some of the work that we're doing here and what our customers are really looking for. Where machine learning can really great, can help automatically, for example, detect and extract text and data from scanned documents better than what you can do with optical character recognition, such as OCR tools that many healthcare systems have today. To also identify the content of fields and in each one of those forms, that oftentimes stored in tables. And you see that a lot also, like, for example, in laboratory results, and the meaning about every value that might be extracted there. Machine learning can also help instantly read virtually just any type of document and extract the data and text without the need for any manual human intervention, other than be able to provide a human in the loop ways about how you can correct that process if the machine having trouble understanding some of these text, or there might be, especially like in laboratory tests, if there's a new test on the market, is be able to also like have different kind of custom codes tailored to each individual, where you can also inject that in the flywheel of the learning of this extraction. You can also quickly automate document workflows and enable process, for example, like 1 million document pages in less than an hour. And then once the information is captured, then you can take action on it within your business application. So you can create smart search indices or build automated approval workflows or this better decision support. And then in aggregate, then that really can not only maintain compliance with document archival rules, but also start really kind of contributing to better healthcare outcomes for each individual that's being taken care of in the system. Let's take an example. For example, here's one form, how it would look like, and then using natural understanding and text extraction, you'll be able to extract every key element within this form, and then map value to that, and then any relation, and then structure in a way that can be fed into a machine learning algorithm for the variety of these use cases. Medical audio is a very common way about how physicians document many of their procedures and tests, and the way that they can dictate it. But also, we're seeing more and more now where there's, especially around, for example, like the telemedicine applications. With COVID pandemic, most of the visits right now are done, especially ambulatory care, are done via telemedicine, such as video or over the phone, and then be able to kind of process this at scale and high accuracy, and then be able to structure this information in a way that is mapped to medical ontology is very, very key to unlock insights from these kind of data. And also, oftentimes medical audio, this is when you're talking to, for example, a patient talking to their doctor, oftentimes there's a lot of vernacular terms being used, such as, for example, it looks like this drug ate a hole in my stomach. I mean, and the medical term for that is ulcer or something similar to that. And so you need to be able to kind of pay attention to those, where a machine is really great at listening to those and be able to kind of extract them in their form, and then be able then to map them to the right medical ontology. A lot of applications we see this today, from medical speech to text application, for example, around clinical documentation. Physician dictation is one of those. Drug safety center calls, and then remote consultation with patients, or even payer and provider contact centers and nurse hotlines. We see a ton of these applications. For example, in clinical documentation, voice scribes can be built to capture both clinician-patient conversation, but even single speaker medical dictation, then be able to also identify, for example, if you're looking at an ambient experience, who's the doctor, who's the doctor aide, who's the patient, and then be able to kind of construct the right level of summarization after that. From drug safety, or we call pharmacovigilance, phone calls from patients and practitioners, and for example, poison hotlines and things about drug adverse effects can accurately be transcribed from patient conversation, and then build a pattern detection on top of that. And as well as telemedicine and call centers, as I mentioned. What we're seeing also with many payers, insurance companies, for example, and healthcare providers, are also using transcription in real time to drive agent coaching and trigger any downstream actions that needs to be taken in real time. Images is one of the most common unstructured form of data in healthcare. So similarly, machine learning can really help detect text in these scanned medical images, and then convert that detected image into a machine readable text, in addition to be able to map what's in the image and the pixels on the image to the actual narrative from a radiologist, for example, the physician who's actually reading the image, or multiple radiologists, and then be able to kind of compare those notes across aggregate of the population, to be able to not only extract the data and the relationship, but also understanding the variation that might happen, and ultimately be able to train different kind of models to be able to pick up patterns. What is normal chest x-ray, for example, or what is a nodule and the location of that, and is this subject to downstream sort of actions and that sort of thing, in order to make sense of a lot of this information. So now that we have all this extracted data in structured form, all the relationships are sort of built, mapped to medical ontology. So how do we make sense of it all? And this is really where we start getting into the understanding of this clinical data. So using machine learning, we can not only extract entities such as disease condition, a medication, the dosage of that medication, the route of that medication, when did they stop or start, but you can start kind of tag every one of these information with the right trait, as well as the relationship, for example, between a medication and its dosage, a test and its result, or a condition and adverse event, and then draw these relationships in order to give a sense or launching view of that entire summary, so that for each individual patient on a timeline, so you'll be able to track the progression of an illness, for example, and the temporality that goes with it. Also, as I mentioned earlier, protected health information identification is one of the key application natural language processing that you can really do that at the highest accuracy today, with very little human intervention, if any. With ontology, then linking, for example, so once you extract all these medical entities, the relations, the traits around them, you can then start mapping them to the right medical ontology. This is common nomenclature across decades of how the data should be structured, and the right standards to follow. For example, if you look at ARCS norms for medications or drugs, or ICD 10 codes for medical conditions, you can start generate accurate codes downstream for processing that data for a number of use cases. You can also, with machine learning, overcome typos, be able to summarize accurately abbreviations or lack of structure, and look at whether this is a generic name or a brand name of a particular drug, and then you'll be able to kind of have a really full sort of representation of the data that's accurately captured in medical terms. If you look at similar with medical conditions, if you map those to ICD-10, for example, you can now start understanding comorbidities and how that relates to the symptoms, and then be able to refine the candidate concepts of that might be related here, and understand complex contextual information to refine also the candidate concept, or the latency, and for example, the upper right lobe of the lung. I mean, so understand the anatomy, understand the location, and as well as the relationship to the actual condition that you're trying to deal with. Here. Temporality is a really key concept that natural language understanding can help extract all these relationships, as I mentioned earlier, the procedure name, how that's linked, for example, whether this is someone had a procedure in the past, or they got a procedure scheduled for them in a future date. What is the diagnosis? Is this a current diagnosis or an older diagnosis? And then figure out any overlaps that you might find in these temporal sort of events that happen. And suddenly what you end up with is a really rich corpus of information that is highly structured, linked, mapped to ontology, that now you can start building a full, complete picture for every patient once you have access to all that information. So, for example, using temporality now, you can finally create a timeline view of a patient from their certain medication over a period of time, or procedures and whatnot, and all mapped in front of you. But also, when you look in aggregation of the entire population, then you'll be able to start seeing some patterns and condition, and start really applying pattern recognition algorithms, or forecasting and prediction algorithms, to be able to kind of further build cohort of this population, to be able to look at their comorbidities, be able to look at their diagnosis or future sort of being risk. For example, someone with type 2 diabetes might be at risk of high blood pressure, and then how you'll be able to kind of test that hypothesis across your entire population. From now, all the data has been structured and linked. Amazon Web Services is helping solve many of these challenges, and the way we're trying to go at it is by providing the broadest and deepest set of machine learning and AI services for your business. So, for example, we enable customers and partners to build secure, compliant, and scalable solutions for the delivery and exchange of medical information across the healthcare industry, or be able to kind of collate information from the many other underpinning systems within a healthcare organization. As I mentioned, where your EKG data is, or where your medical imaging data, or where your medical record data, and then how you'll be able to securely exchange that information and extract the right level of that information to create that chronological view of every patient, and then apply the analytics at the individual level or at the system level, which many healthcare organizations have struggled to do so far. AWS also provides technology and tools needed to provide the interoperability of these systems that can streamline the structured data exchange needed to improve preventive and value-based care by mapping to already known and practiced clinical ontology, whether from the healthcare side or the billing side or the operation side, and to be able to also adhere to many compliance across all these different subsets. We have also developed purpose-built AI services such as Amazon Textract, Transcribe Medical, to go after workflows and surface insights trapped in medical documents or text or narratives. We also have machine learning to the broadest set of services in the cloud, from pre-trained AI services for computer vision, language understanding, as well as recommendations and forecasting. Amazon SageMaker is our platform end-to-end service that allows you to build, train, and deploy machine learning models at scale, or be able to kind of build your own custom model with support for all the popular open source framework, such as TensorFlow and PyTorch and MXNet, if you have those skill sets within your business. The most comprehensive cloud to support your machine learning workloads that comes really from providing all these frameworks or end-to-end platforms, or the specialized APIs that helps from data storage, security, analytics, compute services, and even more. Today, we offer over 500 features and services that focus on, for example, security and compliance. Over 100 of those are HIPAA eligible services with certification for IT industry standards such as ISO, and among many others that can really help with the global customers as well. We also we can accelerate adoption of machine learning with SageMaker. SageMaker, as I mentioned, is our managed service that takes a number of the required steps to build, train, and tune, and deploy machine learning models, and make it much easier for every developer and scientist to use. I mean, our goal is to make machine learning so boring that anyone with no prior knowledge machine learning should be able to do. Once you understand, the kind of question that you have and what you want to go about answering that question, where's the data? And then the SageMaker can really help you with the best-in-class machine learning models that are being trained on many different kind of problems, then be able to kind of leverage that within a really easy to build those models and train them, and before you can really deploy them in your system. It's been helping organizations of all sizes to really embrace machine learning. Before SageMaker, doing machine learning was just too hard for most customers. You need really, if you didn't have a PhD in machine learning or had a lot of depth in it, there was no way for anyone to be able to do this at scale. And by making machine learning easier and low cost and secure, many customers now are making better use of the data they already have, and that is both valuable and differentiating. Models that previously took customers months, for example, to an extensive specialized expertise. Now they can build in few days or weeks. For instance, if you look at how Intuit develops machine learning models that can pull a year's worth of bank transactions to find deductible business expenses for customers with SageMaker, was able to reduce development time by almost 90% and from 6 months down to about a week. Amazon SageMaker also lowers the TCO over a 3-year horizon by at least 54% compared to other cloud-based machine learning options such as self-managed Amazon EC2 or Amazon managed Elastic Kubernetes services. The analysis hold true for small teams of 5 data scientists, for example, or extra large teams with over hundreds of data scientists. In addition to lower TCO, Amazon SageMaker productivity features enable you to put machine learning ideas into production faster and then be able to kind of improve data science production by up to 10 times. In less than 2 years since we've had the service, over 10,000 customers have been adopting SageMaker across pretty much every industry line. And many of them are making it their standard for building and training and deploying their machine learning algorithms. Third, to get the confidence of building on AWS, most comprehensive cloud platform optimized for machine learning is provided by AWS. That's why today, if you look at the amount of TensorFlow, for example, that runs in the cloud, about 85% of TensorFlow in the cloud runs on AWS. We have a team that does nothing but work on optimizing TensorFlow performance on AWS. So if you have those skill sets within your organization that require these kind of frameworks, such as TensorFlow and PyTorch, and they require a lot of innovation, we have that scaled and optimized on AWS. And finally, you need the right high level of security that's reliable and fully featured data store with the right access control, with the broadest set of analytics and really robust offerings. So at all these 3 layers of AWS, the offers from the frameworks to the managed platforms or the specific APIs, you'll have a ton of capabilities that really can for what's needed to for anyone to be able to use these services and to build the next generation of machine learning algorithms or artificial intelligence applications. Pre-trained AI services such as Amazon Textract or Comprehend Medical and Transcribe Medical. This is an area where if you look on top of the stack, you'll be able to integrate AI machine learning capabilities directly into many of the healthcare workflows without any machine learning expertise. Basically, for example, if briefly touch on also Amazon Kendra and enterprise search and Amazon Personalized for personalized customer experience. If I may, I'll show you next how we're able to help many of these organizations with a ton of information trapped in many of knowledge sort of repositories, such as clinical trials or such as archival or maybe many of the decision support systems underpinning and history of how many decisions have been made. So to be able to have an enterprise search that can really sit on top of all this information without necessarily the having the depth and expertise in machine learning is an area that that's of high relevance to many of our customers. We think about machine learning as really as a more of a, like as I mentioned, of a macro level of having these different kind of layers. If you look at the bottom layer, we have the frameworks and interfaces, the infrastructure for expert ML practitioners. Then at the framework layer, there are three main frameworks that we support, mainly TensorFlow, PyTorch, and also MXNet. Very few ML practitioners use more than one framework today. New algorithms are being built and developed all the times in different frameworks that people want to be able to borrow from or run in that framework. So instead of having to port them themselves to different frameworks, we provide that service for that. And we have the dedicated teams for each one of these frameworks as well. I want to mention or touch on one really key example specific to the COVID-19. One of the greatest thing from knowledge discovery and data mining was something we haven't seen in any prior event. I mean, one of the greatest things about this pandemic has been the sheer volume of information being shared by the scientific community and research community and practitioners worldwide. Every day, hundreds of these new articles are being published in preprint servers, pre-peer reviewed, where the evidence is mounting and the evidence is changing over time and sometimes even conflicting with prior understanding. And that's a good thing. The challenge, of course, for many researchers and scientists and practitioners is be able to keep up with this sheer volume of information. So what we've done at Amazon Web Services is we created a search website, a new search websites that powered fully by machine learning that really help these researchers and the public quickly and easily search tens of thousands of these research papers since the early propagation of this pandemic using natural language questions. So COVID-19 uses machine learning to services to power comprehensive and actionable results. The original data set is enriched using Amazon Comprehend Medical. So that way we'll be able to extract all the medical terminology and the entities, all the relationships among these, and then from that, then be able to index this information. So that way we can create various topic modeling on top of that, such as epidemiologic topic or vaccine or laboratory or clinical trial or population, and then be able to help the researcher further navigate these topics in a most comprehensive way just by asking simple questions to search this context and content. By extracting information from a structured text, including, for example, disease, treatment, and timeline, the data then become relevant. For example, we can track the progression of COVID or be able to kind of interrogate the data for finding specific target or inhibitor protein, and then be able to kind of further build a subset of articles that might support or refute the argument that you're going after. The COVID-19 search uses multi-labeled classification model and inference, such as virology, immunology, or laboratory clinical trials. Then this information is indexed using Amazon Kendra.
Thank you so much, Jackie. So that was Taha. I think we're over time, and I think it's time for us to move on to the next speaker. So the recordings are available, as you know. They're both available on Hua app as well as our vFears. You know, if there are questions, you can ask them in chat. Unfortunately, Taha is not going to be on this Zoom chat, but I think there are going to be discussions from further, and hopefully he will be able to join vFears at some point and maybe answer those questions. So at this point, we'll move on to our next speaker. Our next speaker is Jan Schallenberger. who's going to talk about machine learning to detect cancer early. Jan leads the classification infrastructure team at Grail. This team builds a platform to perform robust machine learning at scale. Prior to Grail, he worked at LinkedIn in the advertising optimization team and at ID Analytics, detecting identity manipulation and fraud. Jan has a PhD in bioinformatics and systems biology, where he studied genome scale metabolic